Greetings from Annoor Women Brigade, dear delegates. Myself, Marina Matthew. I'm representing the Department of Microbiology, Annoor Dental College. Welcoming you all for the session, Emerging and Re-Emerging Infections. Despite remarkable advances in medical science and treatment, death due to infectious diseases are still a threat worldwide. Over the past 35 years, at least 30 new infectious diseases have emerged to threaten the health of millions of people across the globe. The major challenge to combat these infections is that, for many of them, there is no specific treatment or cure and no effective immunization programs. There is limited scope of preventing or controlling such infections. So that's the importance of this session, emerging and re-emerging infections. This is the outline of today's discussion. We'll be discussing what are actually emerging infectious diseases and re-emerging infectious diseases. What are the major causes and contributing factors? How are EIDs acquired? What are their modes of transmission? An overview about the various infectious diseases that has happened across the globe, in our country and especially in Kerala. And what all preventive or control measures can be adapted to overcome such situations. A new disease emerged and an old disease re-emerge. Let's see what's actually the definition for emerging infectious diseases and re-emerging infectious diseases. An emerging infectious disease, or EID, is one that has appeared and affected a population for the first time, or that was there previously but is rapidly increasing either in terms of the number of cases, new cases within a population, or the spread to a new geographical area. Then we consider that as an emerging infectious disease. And what are actually re-emerging infectious diseases? This group of infections include diseases that have affected a given area in the past, declined with passage of time, or were under control, but again reappeared in increasing numbers. That is actually re-emerging infectious disease. So once again, a new disease emerge and an old disease re-emerge. There is a saying that it takes more than a microbe to cause a disease. So let's see what are the contributing factors and the causes of emerging infectious diseases one by one. First and foremost, the unplanned and underplanned urbanization. The human encroachment to the natural habitats of animals and birds will force the wildlife to migrate to other habitats. Natural balance of ecosystem is lost. Animals or birds will be forced to migrate and they'll go to other places in search of food and shelter. Of course, along with them, the pathogens are also migrating. These pathogens, they'll get adapted to the new environment very fast. In fact, we, the human beings, are exposed to the vectors and reservoirs of infection. Another contributing factor is international travel and global food supply. Actually, globalization refers to the fact that People around the world are no longer geographically isolated from each other. People and also the pathogens can travel now much more easily. Actually, the international trade of goods and services through the international borders facilitates the spread of diseases by bringing pathogens to new geographical areas. And the travelers, they're of course exposed to many pathogens. Many of them have never encountered and no immunity to many diseases. And this international or the global food supply chain is actually an unseen undercurrent of world economy. Along with food also, pathogens can travel from one continent to another. Another contributing factor is lack of immunization. Many diseases that have declined because of effective immunization programs has started re-emerging only because of lack of immunization, or people are refusing to get immunized against certain infections. So that is also a contributing factors. Inadequate public health infrastructure. Though we have, or our country is well equipped with a public health infrastructure, due to war or some political conflicts, there can happen failure in this coordination of public health infrastructure. So that is a contributing factor for emerging infections. The action or the awareness or the alertness at the right time is very important to control all kind of emerging infections. Another very important factor is resistance to antibiotics. There is a group of bacteria or virus, parasite or fungi which are known as superbugs. These superbugs are actually pathogens that are resistant to most of the antibiotics or other medications commonly used to treat infections caused by them. And it is believed that by 2050, most of the people will be dying because of infections caused by such antibiotic resistant pathogens. And the sad part is, since 30-35 years, there is no new molecule of antibiotic, no new class of antibiotic being introduced for the medical community by pharmaceutical industry. So that is a threat of superbugs. Climate change, the long-term impact of global warming. Some major climatic events or changes caused disease outbreaks in the areas that have not experienced the disease ever before. The microbes will adapt to the new normal very fast, and the pathogens, they'll get opportunities to move about, and they may increase their virulence and their host range. Another important thing is this warmer climates they're actually expanding the areas where these kind of disease carrying vectors like mosquitoes and ticks, they can survive much more. And the microbes will adapt to the changes. New pathogens will be emerging or evolving as an impact of global warming. Migrating birds and migrating pathogens. We all know that birds will fly hundreds and thousands of kilometers to find the best ecological condition and habitats for feeding, breeding, and raising their young. These wild migratory birds play an important role in the spread of multi-drug resistant pathogens and multi-drug resistant gene flow due to the consumption of contaminated food and water Yes, of course, it is known as a silent pandemic. Several investigations demonstrate that these wild birds, when they migrate from a diseased region, they'll uptake the pathogenic bacteria from there and shed them to a new locality. This actually results in the broad range outbreak as well as the endemic spread of multi-drug resistant strains of pathogens. And these pathogens, they'll transfer these drug resistant genes among them through the plasmids. And actually these wild birds, they can act as a reservoir of these kind of pathogens. The seasonal migration of birds has a very important role in the epidemiology of human infections and the spread of this kind of MDR or multi-drug resistant pathogens. The bacteria Escherichia fergusoni is an emerging zoonotic pathogen, very common or very recent example for the pathogen that is transferred from one area to another through migrating birds. This is the causative agent of Ferguson's disease in human beings. This pathogen is resistant to almost all the currently available antibiotics, and at the same time, this can also cause infections in animals, which is isolated from many domestic animals. The recent emergence of infections like West Nile virus, human influenza virus in various parts of the world is actually a prominent example for how rapidly and widely migrating birds spread infections. Urgent need to strengthen the research on this area of ecological distribution of various pathogens in this wild bird will help us to predict the future outbreaks of relevant human infections. As we all know, the influenza virus or the flu virus, the strains are denoted as H1N1, H5N1. The H and N are actually the spikes present on the surface of on the envelope of this virus, heme agglutinin and neuraminidase spike. And this virus is actually one of the most antigenically varying virus. And the genetic reassortment or the mixing up of the genes of this virus is actually happening in pig. It is believed that the flu virus from various geographical areas will meet up in pig. There happens a genetic mixing or reassortment inside the pig, and from the pig through the migrating birds, that pathogen will again be distributed in various geographical areas. Let's have a look into the modes of transmission of these kind of infectious diseases. Majority of the infections are transmitted through inhalation, through exposure to blood and body fluids, through food and water ingestion, percutaneous inoculation, and also absorption from the mucous membranes. World Health Organization publish a list of pathogens termed as Blueprint Priority List. This list includes diseases that have potential to cause a public health emergency, and for these kind of infections, there is a need for accelerated research and development of novel therapeutic or preventive and diagnostic approaches. So this is the Blueprint Priority List published latest, starting with COVID-19 virus, Crimean Congo hemorrhagic fever, Ebola and Marburg viruses, Lassa virus, which again causes a hemorrhagic fever, Middle East respiratory syndrome, SARS, Nipah and Henipah viruses, Rift Valley fever, Zika virus, and towards the end, disease X. This disease X is actually an unknown pathogen that could emerge at any time in future and cause a very serious international epidemic or pandemic. So these are the list of pathogens published by WHO which at any time can cause an emerging infection, or it is being there in the globe always. Now let's have an overview of emerging infectious diseases globally since 1975. In 1975, there was an outbreak of parvovirus B19. 1977, Ebola virus, Legionella, Hanta, and Campylobacter. In 1980, the outbreak of human T-cell leukemia virus or HTLV-1, and in 1982, HTLV-2. HIV and Helicobacter pylori outbreak happened in 1983. There was an outbreak of cholera caused by Vibrio cholerae in the year 1992. Human herpes virus 8 outbreak happened in 1995. There was a major outbreak of influenza virus or flu caused by H5N1 strain of human influenza virus in 1997. And in 1999, there happened an outbreak of Nipah virus. In 2003, there was severe acute respiratory syndrome SARS caused by coronavirus and H5N1 outbreak again. Swine flu outbreak happened in 2009. The strain was H1N1. And in 2012, there was Middle East respiratory syndrome or MERS caused by coronavirus. In 2013, there was again a flu outbreak, but the strain was again different. H7N9 was the strain. In 2014, there was a list of pathogens actually. Ebola in US. In China, flu outbreaks by two different flu viruses, H7N9 and H5N6. MERS in Saudi Arabia, and in Cameroon, poliovirus outbreak. In 2016, there was an outbreak by Zika virus and dengue virus. In 2017, it was again a flu virus outbreak, H7N9 strain. 2018, I hope you all will be remembering, there was an outbreak by Nipah virus, Ebola, avian flu, and MERS again, Middle East respiratory syndrome. And in 2019, as the name indicates, COVID-19 virus, a different strain of coronavirus. Let's have a look into the EIDs and re-EIDs, or re-emerging infectious diseases, happened in India. In 2019, almost all the states in India was affected with COVID-19. In 2018, Kerala was affected by Nipah virus, and the same happened in West Bengal, Siliguri in West Bengal in 2001. Zika virus outbreak happened in Jaipur in 2018 and in Gujarat in 2017. Chikungunya outbreak in 2006 in almost all the South Indian states and especially in Kerala. In 2006, there was outbreak of dengue fever in Kerala and almost all the South Indian states, and the same thing happened in 2003 in Delhi. There was outbreak of plague in 2002 in Simla and 2004 in Uttarakhand. Handipura virus caused infections in Andhra Pradesh, Gujarat and Maharashtra in 2003, 4 and again after a break again in 2016. 2009 there was a flu outbreak in almost all the states of India caused by the strain H1N1. In 2006 there was avian flu outbreak in Maharashtra. The North Indian states were affected with SARS coronavirus in 2003, and Crimean Congo hemorrhagic fever, most lethal infection outbreak happened in 2011 in Gujarat and 2018 in Kerala. And this slide explains the emerging infectious diseases happened in Kerala, starting with Congo fever, then Kala Azar, a parasitic infection, two different strains of flu virus H1N1 and H5N1, Nipah virus, leptospirosis caused by the spirochete Leptospira, chikungunya virus, dengue virus, due to the lack of immunization programs or people who refuse to take or to give immunization to their children, there happened the re-emergence of diphtheria in Kerala. And as the world faced the pandemic COVID-19, the same thing happened in almost all the districts of Kerala also, COVID-19. What are the control measures that can be adapted to overcome such emerging infectious disease? We should have the preventive measures, or we should have a proper planning to prevent all these kind of infections. The surveillance and early response by the medical team is very important. We have to assess the health status, the risk factors, and the proper services provided for each and every individual in the community. Discourage the inappropriate use of antibiotics. And above all, there should be proper initiatives about the research of each kind of pathogens and the multi-drug resistance that is emerging among this kind of pathogens. One Health. One Health is actually an integrated approach that aims to balance and optimize the health of people, animals, and the surrounding ecosystems. These all are closely linked and interdependent. This One Health program actually includes issues such as food security, water quality, antimicrobial resistance, and the climate change. In India, One Health program is with the help of all government stakeholders, and we organize this as the coordinated movement of various national and international forums. It's happening effectively in India. As I'm concluding the session, what I have to tell you is that be aware, alert, and act properly so that together we can control the emergence of such infectious diseases. Wishing you all a very happy and healthy future ahead. Thank you all for your patient listening. Thank you.